Let's do a live demo. How can digital and your online presence, how can it bring you more GP referrals? At first sight, it seems to be a disconnected item, but in this live demo, you'll see that there is actually a very deep connection between your online presence, your digital presence, and your volume of GP referrals. So let's dive straight into demo mode. And also, I'll explain to you why our unique editorial approach, a medical journalism based approach to marketing and to content, why that creates results, different results compared to traditional medical advertising solutions. So, scenario one, let's imagine for a moment that your practice appears on the patient's radar for endometriosis treatment, for example. They are doing a search because it's the very first time they hear the word, the term, conversations with the GP or a family member or a friend. And so their very, very first impression is landing on your content page about endometriosis. And this one would be for Perth. This one here would be the page they land on in Sydney if they were looking for a gynecologist who can help them. And they get to know the doctor. The patient gets to know the doctor. And this all happens even before the patient sees the GP. So that's a very important distinction. This happens in those initial phases. Maybe you have to wait. The patient has to wait before they can see the GP, and they are already Googling. So that's why there is a connection between your online content and the impact of GP referrals for your private practice. So that's scenario one. Some Googling happening before the patient sees the GP. Scenario two, the GP actually writes the referral to a specialist that they're connected with, or a specialist that they know, they're familiar with in their catchment area. Again, there is the impact of digital when at that stage, the patient may have certain ideas that they found online. The concept of positive birth, for example, of really, really having that quality connection with the obstetrician as the expecting mum prepares to give birth. And as the mum has done some Googling and watched some online content, some online videos maybe, she will ask different questions to the GP and maybe ask to change the referral to a different specialist. And then there's scenario three, elective procedures where the patient is really actively doing their online research and looking for the best possible solution in anterior hip replacement, in tummy tuck surgery, or typically in bariatric surgery, where there's a lot of shopping around going on and the patient is looking at different pieces of content online with just one intention: to have answers to the many, many questions they have, and in that process to find out who's the most trusted surgeon or specialist that I can see. So in these scenarios, we see that, yes, there are direct inquiries being triggered by this online content, by your excellent online presence. And yes, there is an impact on the effectiveness of your GP referrals. If you're only focusing on your connections with the GP and you're not taking care of your online presence, well, chances are that some of these GP referrals might get lost in cyberspace, to use an old-fashioned expression, because the patient has done their own Googling and has made up their mind to go and see a different specialist. So bottom line, it really pays to have a really strong online presence, not just to capture the direct inquiries if you're doing really elective procedures, but also to make sure you are an influencer in your own way, in your own space. So you can influence the flow of GP referrals in your catchment area. No presence means little impact or no impact at all. And in that case, patients may end up in somebody else's consultation room. If you want to apply this, what I've shown you in the demo today, to your own practice, feel free to book a free one-on-one strategy session via Zoom. We'll talk about your practice, the stage you're at, and how to apply this principle to make sure you get the most out of your GP referrals. I look forward to meeting you.